Now turning to a major turning point in the battle against COVID-19 right here in New York City. For the first time since the outbreak in mid-March, no new coronavirus-related deaths were reported for a single day. An average of 500 new fatalities were announced each day during the peak of the pandemic in April. The news comes, of course, as the city prepares to begin reopening next week. Dr. Bob Lahita is with us from New Jersey and joins us now to talk about CDC projections showing COVID-19 related deaths in the U.S. could be on the decline. So let's bring in Dr. Bob Lahita. He is with us from New Jersey to talk about all this. So Dr. Bob, new CDC projections show COVID-19 related deaths in the U.S. could be on the decline. I guess the question is, how is that calculated? Are we looking back at a couple of weeks? Because it's not forward looking, right?
That's not forward looking. It's looking back and looking at our hospital, for example, the number of admissions has dropped precipitously. The number of deaths are practically nil right now, and I'm just blown away by this whole thing because I can't understand it. I'm saying that if mitigation works, it really worked, because I didn't expect to see this dramatic a drop in cases. We're basically reverting back to normalcy here at the hospital.
So we've learned now that the Trump administration has asked the states to provide demographic data in regards to COVID-19. How will that help to give us a better picture of who this disease is affecting and how?
Well, as you know, the Midwest and the southern states have, with few exceptions, been preserved. Even within the state of New Jersey and upstate New York, the cases have been far lighter than we see in the urban areas. So it's going to help us based on demographics. Now, I'm getting some data from my colleagues to show that certain ethnic groups, not necessarily African Americans, but other groups like the American Indian and the Hispanic population, are greatly affected, more than I would have expected. Other groups like the Arabic population is not so affected, which is pretty interesting because it sort of indicates that immunogenetics has a great role to play here as to whether you manifest symptoms or do not. All of the doctors and scientists have thought that for a long time. It's time that we may have to do some research in this particular area.
Meanwhile, the FDA has posted test performance data on 4 more antibody test kits. What do we know about these kits and how would they work? And, you know, I've been interested in getting the antibody test, but then you hear from reporters, from officials, federal officials in the healthcare industry that say they're not as reliable as we might expect. What do we know about these particular kits and how they would work?
Well, for your viewers, the antibody, as you know, is a protein in the blood that's secreted by certain cells, plasma cells, and made against an infection. So we have different kinds of antibody. The one that everybody is aiming for right off the bat is the IgG antibody, which varies from individual to individual. In other words, you can have a family of 5 people, 2 of them will have a high IgG manifest, and the other 3 people will have virtually no IgG. So right now, if you get an IgG test, which you can get commercially, it'll just tell you whether it's positive or negative. And in some specific FDA-approved studies, you can actually get a strength. We call that a titer, meaning that you or I could really react to the virus very, very strongly. We're looking for those people because we'd like to take their blood out of them, separate the plasma, and give it to somebody who's struggling to stay alive. That antibody would be what we call neutralizing IgG. Now, optimally, the best thing to do is to have several different types of antibody, IgM, IgA, IgG, and those 3 isotypes, as we call them, of antibody are going to be very important going forward to tell who's been infected, who is at risk, etc. The specificity and the sensitivity of the antibody is also important. So you don't want to have an antibody that says that you've been exposed to the virus when in fact you haven't. That would be a false positive. Nor do you want to be a negative and be told that you've never been exposed when in fact you just had the disease, and that's a false positive. So there's really very strange. That would be a false negative. The other one's a false positive. But the sensitivity and specificity of the test itself is critical, and that's what's holding up FDA approval. And that's what makes it difficult in the laboratory to develop these particular tests.
All right, doctor. So I really want to get your take on this. You know, every once in a while there's a story that happens in the news, and it just makes me tired. So the Lancet, a medical journal, has announced that it is retracting a published study on the drug hydroxychloroquine. This is the anti-malaria drug that everyone knows about, that the president touted as a good treatment for COVID-19. The response to the president's assertion by many medical experts was there was not enough research to determine that that's the case. And then we started to hear about studies that, indicated that hydroxychloroquine may be actually problematic or, best case scenario, ineffective. One of those studies is published in the Lancet. They are now retracting that at the request of, as I understand it, the individuals who published the study. What's going on? Why did the individuals and the Lancet lose faith in this study? And what does it mean? Because we're talking about, I think, 2 retractions, the Lancet and another publication. But there are also other studies on this drug, too.
Yes, the other publication was the New England Journal of Medicine. This was a tremendous number of cases, which was pulled from several hundred hospitals. And I was impressed with the data if it could be backed up and proven, but the dates were wrong. Some of the dates where they had claimed to get data from patients indicated that in certain cities, for example, in Istanbul, there were no obvious cases until a certain point in March, but yet this study had reported many, many cases before that particular date in March.
Bob, thank you very much.